The COVID-19 pandemic is in the rearview mirror, but for many, it has us questioning when the next pandemic could happen and what it could look like.
Nick Noliff has been researching this and has more on what's being done to prepare for the next one.
To first understand how to stop a pandemic, you have to understand what it is, and in turn, what an outbreak is.
An outbreak is contained to a certain space. So an epidemic is a large number of cases in a confined, larger area, and a pandemic is global.
According to the National Institutes of Health, pandemics are becoming more frequent, and this comes with the emergence of more zoonotic diseases.
We monitor zoonoses, animal infectious diseases. Are we going to find a virus that the animals have that humans have never seen? And if humans have never seen it, that means our immune system is not adapted to it.
Illnesses like Ebola, influenza, Lyme disease, and even COVID are all considered zoonotic in nature. So, how do we prepare for the next pandemic? Well, doctors say monitoring systems are paramount.
We have something called syndromic surveillance. So we look at visits to emergency rooms all over the Commonwealth, and our team can see trends of illness.
And health officials have a new tool, wastewater monitoring.
It had been around but hadn't been developed that much until during the COVID pandemic. And we now are using that much more extensively.
To prepare for the next pandemic, medical officials are working together at the local, state, and federal levels.
Data gets bumped up from the county level or city level to the state, then to the CDC. That gets bounced up then to other organizations that follow that globally.
Now, some doctors are concerned about the potential impacts of cuts to federal monitoring programs.
We've lost a lot of the capacity to respond to emerging infections by dismantling a lot of our international aid infrastructure.
But Dr. Laurie Forlano, the state epidemiologist for Virginia, says many measures are still in place to effectively prepare.
We saw money come in. COVID-19 investment and resources in public health. And we've been able to build a lot of infrastructure in public health and in healthcare.
However, providing more funding for pandemic preparedness and public health in general is still needed.
But if you don't sustain those investments, they're at risk.
Public health officials are constantly working to keep folks healthy, efforts that can sometimes go unnoticed.
I think about public health is that when we're doing our job well, others may not notice, because it's hard to draw attention to, say, the absence of disease.
This is why health officials encourage taking measures to keep yourself healthy now, including staying up to date on your vaccines.
Back in the early 1900s, 1 out of 5 children did not live to their 5th birthday. We don't want to go back to that. It was for several factors, but one of them was infectious disease.
Staying vaccinated against preventable illnesses can help to keep everyone healthy through community immunity.
If you have enough people vaccinated around somebody else who can't, there's nowhere for the disease to spread to, because it immediately just stops.
The next pandemic will ultimately happen, but healthcare workers say they are doing what they can to mitigate the circumstances.
I wish I had a crystal ball. It's the one thing I'm missing, but I don't. So we do our best to maintain a state of readiness and preparedness so we can quickly respond.
Speaking with the Virginia Department of Health, officials are more than willing to talk to people about concerns. Now, Dr. Forlano says public health information is vital to keeping people safe, and that she wants people to, quote, have the information they need to make the decisions they feel are best for themselves and for their families.
That was Nick Noliff reporting.